It's time for our panel, so please, I would like to invite Pinja and Roeaan back to the stage. So we will have a short panel discussion before the lunch. Okay, so we all know the challenges we have today at the moment and recently, which infect the innovation, but I'm very happy that all of you had your presentations quite positive. But just to highlight, what would you say, what are the most important factors to increase innovations through partnerships? Maybe Martin, you had the mic.
Well, actually, I think you had one point up in your slide saying something about sincerity. I think this level of trust needs to be increased. I mean, we have to get out of the bubble thinking that it's not fine, or you can have your hands get dirty by working with private. We need in the public sector to realize that we can only succeed by actually joining these kind of forces, as there's so much power, so much knowledge that's not been utilized because we're kind of hiding away between barriers that is made by others. So we need to break down those barriers.
I completely agree, and I think it was really interesting when you showed about kind of staying in the problem space in the beginning, because I think that's where trust is built. If we can stay there long enough, everyone knows kind of what is the shared goal and what does everyone benefit from the partnerships. I think that's where we need to stay more. But I think it's also about what we've been talking about, kind of new capabilities. I think we shouldn't stay in the problem space with the kind of usual point of view. I think we need to already there have new capabilities involved. And for example, design being one of them, kind of looking the problem from a different angle.
And I agree with that, obviously. And if I were to add something on top of that, probably an exercise of signal processing is also needed. We need to be super sharp. There's a lot of noise. There's a lot of new technologies out there. There's also a lot of problems. So what do we solve first? What has most impact? So, usually in healthcare, you have something, as fundamental as health technology assessments, HTAs. So when something new comes in healthcare, whether it's a new pharmaceutical product or a medical device, you try to sort of measure the impact of that. And perhaps we should have some signal processing on the problems we're trying to solve as well. So that we're super sharp in the partnerships. What are we trying to solve for? So it doesn't just become a public affairs messaging kind of a thing. Yeah.
Thanks. And question for Martin. Now that Timo need to leave, so you are the only one representing hospital side. What kind of concrete needs do your hospital have now or in near future that could be solved through different kind of innovations, and how do you see the collaboration? Is it easy to find partners in these innovation activities?
It's easy to find partners. I don't think that's a problem. I mean, as a public employee and utilizing the taxpayers' money, there's something about competition and how do you leverage procurement and these kind of things. But we need to put that a little bit away, and then we need to focus on where do we move the organization. There's a lot of need there. I mean, obviously one of the greatest one is to keep patients out of the hospital. So keeping the people at home is probably the major point when you look upon the demographics that we're looking into. So how do we actually scale those engines that we can still monitor, we can still make people safe and feel that they are close to the doctors and the nurses they need, but they're not in hospitals. I think there's a huge driver there for change. And then you can, pick down an individual kind of smaller problems. But I think that is the most overcharging problem that we have. And everybody's trying to solve that. So that's where we just systemic approach. They're saying, okay, should we all, use the same forces to solve the same problem, or should we go more together? How do we actually get that also cross-national cooperation? Because most of the projects I hear about has somewhat the same kind of flavor. So there's really a coordination issue that we need to deal with.
And then question to Pinja and Roeaan, how do you see the situation? from the private company perspective? Is it easy to collaborate with public sector or to find these projects or to fulfill these needs?
I think it's both. I think if we have a clear common problem, then it's usually, that makes it a lot easier. But also at the same time, coming from a pharmaceutical company, and the slide you had of kind of the old school image that people might have, for example, about pharmaceutical companies, we have baggage. So that's something that we have to kind of overcome every time we want to form a partnership. And that's exactly also why I say that we need to stay kind of creating the common goal first, because that's the only way to get through that barrier.
Yeah, and perhaps I want to highlight two things. The first one is, again, as a pharma company, when you engage with a healthcare provider, there are some very strict guidelines on how you do that. So in Denmark, for instance, there's really two things by definition you can do. One is disease awareness, or the other one is promotion, so marketing, right? And so coming from the innovation team, we'd like to do other stuff beyond that. And neither the regulators understand that, even our own leadership may not understand it, and the other side of the table, the healthcare providers, don't expect it either. So there's some fundamental stuff that's not in place. Then there's often also some misaligned incentives. So if you take secondary care in Denmark, there's definitely at the hospital level a strong motivation to keep patients at home, try to optimize resources, not have that many consultations in the clinic as such. But then in primary care, you might have the opposite incentives. You know, these are individual businesses. These are entrepreneurs, business owners, the general practitioner. And in some cases, they actually want patients to come in because every time you swipe that insurance card, there's a fee-for-service system that accommodates that. So aligning on those incentives, I think, would be an ask from my side, that at a public level, have we structured the healthcare sector in such a way that we're all working towards the same goal, or are they sometimes working against each other? Yeah.
Yes, and continuing question, Pinja, we have a lot of regional collaboration here in Finland in healthcare sector. How do you see it? Should we increase the national collaboration or international collaboration? How do you see it?
I think definitely we need to increase it. I think it's not, well, to be fair, the reform is quite recent, and I know there's been a lot of energy put into just putting the structures in place, but I think the next natural step would be to increase the cooperation between the regions at the moment. So I think we have a long way ahead of us, but a lot of potential also. And what we see also, for example, from our project with these well-being services counties, that everyone is eager to share. I think we need some kind of structure and more national guidance around that.
Yes, I agree. And what about Martin and Ryan? Do you have some kind of insights that we could learn from you, from something from abroad that we could bring here in Finland? What should we do better?
I don't know if I'm the right one to give you any good advices. I actually like your old system. It was like the incentives basically were there to do prevention, and I think you have less of that incentive now, but we have the same system that you have. I think there's something about, I think actually legislation-wise, I think we are moving, and I can hear that so are you, and our new reform will also improve something about the GPs and incentive structure. I think we actually, maybe instead of giving good advice, say we need to join forces about how do we utilize the very good registers we have across the Nordic countries. Because suddenly we would then be a total market of 25 million or 30 million people instead of being 5 independent markets. I think there's something about joining forces across that could benefit the whole region and our patient group, because suddenly we would be a larger factor. Also for investing in all kind of funds, the European Union, the VCs, the big companies. So there's something about joining forces that we should do a lot better at both legislation level and also at institutional level.
Yeah, so I can only echo that, especially when it comes to new groundbreaking technologies, whether you're setting up a supercomputer, quantum computer, whatever, right? Then there's definitely some knowledge sharing that can happen cross-regionally. I also think at the same time, healthcare is a very local thing. So there's some local dynamics that are not scalable as such. That's why companies like Apple, Amazon, and Google, they've all failed a little bit, at that sort of downstream activities of healthcare. But I think on the upstream activities, there's really opportunities to partner internationally as well. Yeah.
Great, thank you. And just one more quick question and short answers, please. We all know that Christmas is coming soon and Santa is from Finland. So what would you wish from the Santa Claus so that we could improve innovations and partnerships?
I think this is probably a common theme. Needs-led innovation is probably what ties everybody together. That would be the wish from here.
I believe in Santa Claus, so I'm asking for courage. I think we need to be brave to do things differently, really. Now's the time.
Well, keep believing and share more.
Right. Nobody asked money, but thank you. I think we have short time. Maybe if you have some questions
let's
from the
take
audience.
some questions from the audience. Yes, madam.
Thank you. My name is Susanne Cavalco. I'm leading and consulting our EU-level research and innovation activities at Helsinki University Hospital. Thank you for an interesting panel discussion. I was missing one thing, which is really something I'm very interested in, and that is environmental sustainability. You did touch upon the healthcare system sustainability in many ways from your interventions, but I know that the healthcare sector has a lot of things we could do quite easily to also bring some change in the environmental matters. I know the companies, the big pharma, the big tech companies, many are very keen on starting to collaborate with, for example, hospitals on these matters. So any thoughts how we could accelerate this stuff on our own, but also collaboratively, for example, on the Nordic level? Thank you.
I actually think it's a very important point, and I had one slide about sustainable hospitals, and I was focusing on the workforce. But on the other, we're actually trying to develop metrics to be able to actually also to measure what is our burden and how should we ease it. Because if we can make that measurement all the way down to the individual unit, it's very difficult to drive change. We need those data, and they're too weak today. So one of the innovations should be to put down those micro data on each individual consumption level, basically, to be able to drive the change. Then I have another bottom line that I can serve apart from patients, and then I also need to serve that bottom line. But right now, it's a difficult incentive structure as there's no figures on operational level to be able to make change. So it's in the awareness, but putting it into daily operations, there's a lag there, and we need to develop that. Hopefully, some of these things we're talking about could make that faster.
Yeah, sure. I think there's a shared responsibility around sustainability from an environmental point of view. So the industry can design their drug delivery products in such a way that it's environmentally friendly. The hospitals can work more sort of proactively around disposable products, etc. I think perhaps if I could challenge it a little bit, sometimes our very sort of CO2 focus can sometimes also make us very short-sighted. If we take AI as an example, in the very short term, AI has become a huge energy consumer, right? That brings a dilemma. What do you do, right? Do you leverage the great technologies that it could bring with it, the synergies? We're building all these data centers, data ecosystems, but then we can't really leverage all that data if we don't have groundbreaking AI to sort of analyze that. So there's also some dilemmas out there. So, and then we can see things sort of naturally come about. So the whole nuclear wave now, all the tech companies purchasing long contracts on nuclear energy as a way of supporting that wave. Sometimes this discussion can make us a little bit short-sighted, whereas some opportunities lie. So yeah.
And I think it's also about like how do we measure this, for example, in our partnerships. And I think the good side of the digitalization and patients, for example, being at home is also the positive sustainability aspect of people not having to travel and being able to be treated at home. So I think we need to look at more holistically also when we create new ways of working.
Just want to add, I think also that we need to get down to the really brutal discussion about where should we not treat and where is the damage larger. And we haven't got to that point yet. So I don't know whether that's the same thing you're touching upon, but there's also something about treatments that we develop that is way too costly to the amount of people that actually helps compared to what the damage it does. And we don't dare to take that discussion, but it will become there in the next 20, 30 years. It's not us, then our children will take it. But if we are responsible, we should start taking that discussion.
Another question, because I have a question. Does anyone else have a question here? Yes, over here. Thank
you. So you mentioned that need-driven innovation is what ties everyone together. And I also kind of seen that different stakeholders in the healthcare system speak different languages, so to say. How do we make sure that the way that we approach these are tailored to them so that we can actually speak one language and drive the need-driven innovation?
My favorite topic. Because as a service designer, I think one of the key things is the visualization piece. When we define the problem, we need to visualize it so that we kind of get the understanding that everyone is talking about the same thing. Because many times, for example, in our partnerships and projects, we have found out at some point when we put together all the insights and we kind of visualize the problem, that many people have assumed that some of the fundamental, even words in our discussions have meant different things. So I think and that also links back to me being a parrot and saying all the time, stay in that problem space. But I think that's the key thing to make sure that everyone is talking about the same thing.
I will ask a question. So going back to Martin's picture with all of the circles and the different partners. So if you think about building a partnership or consortia, you've got very different types of organizations that run at different clock speeds. And they're also doing their day jobs as well as going into a partnership. So is there a way that we can maybe use more AI to auto-generate and remove some of the friction when we're building these partnerships? And then also to report on the results as well?
Probably, but I'm not sure we're going to necessarily need to apply an AI tool to do that.
Problem solved. No. Okay, any more questions?
But actually, it's an interesting question because sometimes we do want to solve things with the most complicated way of solving it. And I'm not quite sure that's the way we should solve it. I think we should open our doors a bit more to be able to have humans actually meeting each other. Because getting that interaction among humans, sometimes magic happens instead of us being instrumentalized by somebody else who tells us what to do. And I could be a little bit worried about having all kind of things telling me what I should do. I would probably get a little bit offended by it or something. So I do think that we need to have a more open door policy and need to actually focus on those common denominators for success. And then we need to talk about what not to do.
Very good. Time for one more? Going. Hey, let's big round of applause for our fantastic panel here and the questions as well.